Hi, and welcome to Student Med. Today we're going to be discussing pseudogout, or calcium pyrophosphate disease. Pseudogout is a form of arthritis as it causes pain and inflammation in affected joints. It is called pseudogout as it presents in a similar fashion to gout, in which there is acute onset joint pain, swelling, and erythema. Both conditions are caused by a buildup of crystals within the cartilage and synovium of a joint. Crystals in gout are composed of monosodium urate, whereas in pseudogout the crystals are composed of calcium pyrophosphate dihydrate, also known as CPPD. Joint aspiration and microscopic evaluation is required in order to differentiate between the two conditions and provide an accurate diagnosis. Monosodium urate crystals in gout appear as yellow-shaped needles with negative birefringence. Calcium pyrophosphate dihydrate crystals in pseudogout, however, appear as blue rhomboid shapes with weakly positive birefringence. Pseudogout often affects larger joints, most classically the knee, whereas gout will affect the smaller joints, typically the big toe, which is known as podagra. Risk factors for developing pseudogout include age. Typically, pseudogout presents in patients older than 60 years old, osteoarthritis, previous joint injury, previous surgery, and in those under 60 years old who are suffering with pseudogout, metabolic conditions are more likely to be the underlying precipitant. These include hypomagnesia, hypophosphatemia, hemochromatosis, a genetic disorder in which too much iron is stored in the body, where it's believed that the increased ferric salts within the joints of patients with hemochromatosis leads to enhanced calcium crystal formation and also inhibits their removal. Hyperparathyroidism, where high levels of parathyroid hormone consequently leads to a rise in the serum levels of calcium. And Wilson's disease, a genetic disorder in which excess copper builds up inside the body. If pseudogout is suspected, there are a few investigations that need to be performed. As mentioned earlier, joint aspiration, or arthrocentesis, is important to exclude septic arthritis and also look for the presence of the blue rhomboid-shaped calcium pyrophosphate dihydrate crystals. An X-ray of the affected joints should be performed, in which there may be a finding of chondrocalcinosis, or cartilage calcification, which further suggests pseudogout. And then, to investigate a potential underlying metabolic disorder, a blood test should be arranged. Serum calcium and PTH levels should be assessed in order to identify hyperparathyroidism. An iron study should be performed to look for hemochromatosis, and serum magnesium and alkaline phosphate levels in order to exclude hypomagnesia and hypophosphatemia. The aim of treating pseudogout is to reduce the pain and improve the function of the affected joints. Therefore, for acute attacks, intra-articular corticosteroids are advised. If these are not tolerated or are contraindicated, then oral NSAIDs are prescribed in order to provide pain relief and reduce inflammation. For patients with chronic or polyarticular pseudogout, which means they have many joints affected, then oral corticosteroids are another option for managing symptoms. Thanks very much for watching. If you found this video helpful, then please do like and share, and I'll see you in the next one.